Hello everyone, my name is Asri Maharani. I am a lecturer at the Faculty of Biology, Medicine and Health at the University of Manchester, UK. Today, for the next 15 minutes, I would like to talk about the impact of air pollution on non-communicable diseases. This presentation is part of our project with the Global Health Research Center for Non-Communicable Diseases and the Environmental Changes funded by the NIHR, UK. As we already know, pollution is the presence of substances into our environment that are harmful for our health. And pollutants is the harmful solid or liquids or gases, the harmful substances itself produced in the higher than usual concentration, which reduce the quality of our environment. And air pollution, in conclusion, is the presence of the pollutants in the air. And of course, it will have detrimental effects on our health and our environment. The history of the air pollution have started a few thousands years ago. So evidence from Greece shows that the problems of polluted air in outdoors and indoors were being documented at least 2,400 years ago. The books Air, Waters and Places attributed to Hippocrates from 400 BC suggested all sorts of illness as being related to the quality of air. The worst it seems was in the cities facing damp westerly winds and where the inhabitants are likely to have deep hoarse voices because of the atmosphere, because they thought that the atmosphere is impure and unhealthy in such places, which was true. Air pollution then has get more attention, and they get quite a lot of attention in 1950s when there is a London smoke. London smoke in early 1950s are resulted from the burning of fossil fuel at that time, and then it caused mortality on approximately 12,000 people. The public and then more slowly a political reaction led into the introduction of the Clean Air Act in 1956, around 3 years after the event. Air pollution changes over time globally. It is notable that on the global scale, Europe and North America were responsible for most, greater than 80% of the global air pollution, including SO2 emission, prior to 1970. Emission in North America then grew rather faster than those in Europe, and with toll tax also used in North America to disperse pollutants to minimal local effects. The global emission of air pollution, including NH3, then increased rapidly during the late 20th century, in the figure 3 here, as consequences of the increased energy consumption, transport, and agriculture activity. This graph also shows us that there is a major shift since 1980, where China and the Asia and Pacific region have replaced Europe and North America as the main global source of air pollution. Which economies have the highest and lowest air pollution? In a study by the European OECD, air pollution measured here in this study, air pollution is measured using the fine particulate matter PM2.5, which pose the greatest health risk compared to any other pollutants. Here we can see that the countries with lower GDPs, including India, Pakistan, Bangladesh, China, and Indonesia, tend to have higher air pollution, mostly because they prioritize basic necessities over filters and other cleanup technologies than the wealthier countries use. In this study also, we can see that the lowest air pollution of the economy studies is New Zealand, a developed island nation. There are 6 common air pollutants. The first one is particulate matter, and then the second one is ground level ozone, nitrogen dioxide, sulfur dioxide, carbon monoxide, and heavy metals. Each of them is actually have effect to our health separately. Particulate matter is the one that is quite famous, and we usually have the size of the PM10, PM5, and PM2.5. The possible sources of air pollution can be categorized into outdoor air pollution, such as industrial activities and cars, and indoor air pollution. Approximately a quarter of urban ambient air pollution from PM2.5 is contributed by traffic, so our cars, and then 15% is by industrial activities, which include the electricity that we have, and 20% is by domestic fuel burning. While the exposure to indoor air pollution, mostly due to the solid fuels for cooking, and it is usually available in the low-income households. WHO has identified climate change as one of the greatest health threats in the 21st century. Globally, the fine particulate matter and ozone air pollution cause 8 million deaths per year, and almost like most of them, more than 50% of them, is related to the cardiometabolic condition, including heart disease, and stroke and chronic obstructive pulmonary diseases both account of the 16% of the mortality. We will look at each of the diseases separately. From this slide, we can see the pathway on how air pollution lead into non-communicable diseases. So we can see here that the carbon monoxide, the ozone, PM, they can lead into non-communicable diseases, which include the pulmonary diseases, chronic obstructive pulmonary diseases, CVD, cardiovascular diseases, which can include atherosclerosis, hypertension, and also the heart failure. And it's also lead into cancer. It can lead into liver cancer and skin cancer, lung cancer, and also brain tumor. Air pollution affects our respiratory system, as we know. However, from our research, from previous research in China, this is a good example on how air pollution affects respiratory system. They have intervention in 3 years, which is called the 3-year action plan to win the battle for blue sky. And from this 3 years intervention, we can see that lowering air pollution in 3 years is reducing the risk of COPD hospitalization and the risk of COPD among older people in China. And this provides evidence that the intervention to reduce the air pollution is actually effective to reduce the burden of the respiratory health. The mechanism on how the pollutants affect our respiratory system is through the inhalation of the polluted air, which is contain the PM, and then also the PAH, the polycyclic aromatic hydrocarbons, and also the microorganism. This exposure includes and induces the production of the reactive oxygen species, or what we always say ROS. And this ROS can cause the death of the normal flora in our respiratory tract. And this will allow the microorganism to invade our airway. Accumulation of the ROS will damage the epithelial layer and trigger the inflammatory response. The constant inflammatory response in our respiratory tract, it will lead into several respiratory problems here, which include emphysema, small airway disease, and chronic bronchitis. Moving into the relationship between air pollution and cardiovascular diseases. A study in the Europe, you can see here from the map, in the Europe there are 790,000 excess deaths estimated due to the air pollution per year in whole continent. And from their study, 40% of the excess mortality due to the air pollution are ischemic heart disease and the 8% due to the stroke. This shows the importance to tackle the cardiovascular diseases as the impact of air pollution. And we can see here that 7% is due to the lung cancer. We will talk about lung cancer later. And 6% is due to COPD, and 7% is due to pneumonia. And then the global data shows a similar trend. So we can see here from the map that the highest number of the cardiovascular disease mortality attributable to the air pollution is in Asia. So we can see here that India, China, some part of the Middle East, and a few big part of the Africa, Indonesia are also included, are affected or have a quite high global mortality due to the cardiovascular disease attributable to air pollution. How is the mechanism of air pollution can affect the risk of cardiovascular diseases? The air pollution increases the cardiovascular risk through direct and indirect mechanism. And the direct mechanism is, of course, the air pollution, the particle inside, and then it can increase the inflammatory and also the blood pressure, and it can be induce the coronary artery calcification. But we have also the indirect mechanism on how air pollution affect the risk of cardiovascular disease. For example, one of the good example is physical activity. So if, for example, if the air is polluted, I can give some example in Jakarta, for example, if air is quite polluted, and then it will then limit people to have a physical activity outdoor. So less physical activity then will increase the CVD risk factor, including obesity and hypertension, which then lead into the increase of the inflammation and blood pressure, and then lead into the damage of the coronary artery or plaque in the coronary artery. Similarly, with another mechanism, including sleep, for example, so air pollution is reduced the sleep quality of the people and other behavior, health behavior. So because probably more people at home, lifestyle change, more people smoking or drinking, and then increase the risk of cardiovascular diseases. Other than behavior or lifestyle mechanism, we have psychosocial factors also. So air pollution can increase the stress of the people and also increase the anxiety and depression and limit the people from social interaction. The loneliness, social isolation, and depression then can lead into stress and higher or in the increase of CVD risk factors, including obesity, diabetes, and other risk factors. So both direct and indirect effects of air pollution can then increase the risk of cardiovascular diseases. One example from a study, the increase of PM2.5 exposure per 10 microgram per cubic millimeter during the preceding day increased the systolic and diastolic blood pressure by 0.5 to 1 millimeter mercury, with the wide range of responses, of course. And the long-term PM2.5 exposure is associated with increase of carotid intima media thickness, coronary artery calcification, and other cardiovascular diseases. The mechanism on how air pollution can increase the risk of cancer are not yet completely understood, but the prior study explained that there are hypothetically 3 processes on how air pollution increases the risk of cancer. The first one is the initiation, the second one is promotion, and the third one is progression. The carcinogens in air pollution can lead into disruption of molecular process here, and it can be through the direct or indirect process. It can be induced the TSG inactivation or activation of the oncogenes, cell cycle alteration dependent on the TP53 activation, or the activation of the energetic dysregulation and chromosome instability. So several mechanisms of the molecular changes then can lead into the 3 process of the how air pollution increase the risk of cancer. A study in Perth, Australia, a cohort study, shows the association between air pollution and lung cancer, and it finds that the lung cancer is associated with the fine PM or PM2.5 and black carbon, and the result is still significant even after adjusted for other covariates. They find a weak positive association between cancer, the bladder cancer, and also the air pollution. Further research are required for this field so we can know how then the air pollution can affect the risk of the cancer. Air pollution affects people in different ways. Older people, children, and those with pre-existing health conditions are more sensitive to the health impact of air pollution. In addition, the most deprived people in the society also often have the poorer health and less access to the high-quality medical care, which will increase their vulnerability to air pollution. From this graph below, we can see the age, so older people, young infant, adults and children with asthma and other respiratory diseases, and adults with cardiovascular diseases are among those vulnerable to air pollution. Health condition also make some difference, where allergy and pregnant women and newborns also vulnerable to the air pollution. Next, we will discuss how low socioeconomic status make the impact of our air pollution to the population health behavior. Previous research. So this is an example of the previous research. Previous research in the UK has shown living within 50 meters of the major road is associated with stunted lung growth among the children here. So the researcher found the average lung growth of children between the ages 11 and 15 who live near the busy road was likely to be stunted by 14.1% in Oxford, 12.5% in London, 7.7% in Birmingham, 5.3% in Bristol, and finally 2.8% in Nottingham. So we can see here how air pollution impacted children very badly, and they will then bring it into the later stage of their life. A study on around 51,000 women from the US shows that the relationship between PM2.5 exposure and cardiovascular disease risk are higher among people who living in the lowest quintile of the neighborhood socioeconomic status, and also the highest quintile or highest percentile of people above poverty. It's also shown that among the people in the lowest economic quintile, the people in the lowest home value quintile, and also the people in the lowest occupation group, they have a higher impact of air pollution on the cardiovascular risk. As a conclusion, air pollution and non-communicable diseases represent one of the most serious threats to the global health. Tackling air pollution thus becoming one of the most effective strategies for fighting the global non-communicable disease epidemic, which is the driver of poverty and the major obstacle of the sustainable economic development. If we address air pollution, it could generate benefits to prevent other diseases also. For example, if we improve a family access to clean cooking, not only we will lower the risk of pneumonia and burns, but we also will reduce their chance of having chronic respiratory and cardiovascular disease. We should remember that some people are more susceptible than the others to air pollution. Their groups include children, pregnant women, older adults, and individuals with pre-existing heart and lung diseases. Intervention to mitigate and adapt with the air pollution then needs to target this population better. There are some references for this presentation, and thank you.